to start just by getting everything hooked up. This is a little bit like hooking up the car battery with a ground and an active and a reference electrode. I need to be certain specified distances away so that we can standardize the responses and compare them to normals. So you're going to feel a little shock here, a little zap through your carpal tunnel right now. And then I get a response on my machine. That response took 5.1 milliseconds to go through your carpal tunnel, which normal would be less than 4. So that's slow through your tunnel. And then a zap up here. And then we're going to measure the difference and figure out how fast it is. So this segment here is 50 meters a second, which is good, but this segment here is slow, which is right where the carpal tunnel is. Okay. Which fits well with your symptoms. Your classic symptoms of carpal tunnel would be numbness in these fingers and half of that one, which is exactly what you described. So here's going to be a little zap here. Now we're testing the ulnar nerve, which is outside the carpal tunnel. So another zap. And then we get a pretty good response there, although that's a little slow. A little better as I turn the juice up. You doing okay? Mm-hmm. Typically this is about as bad as it gets, really. Here's a zap here. Another one above your elbow. So now we're done with the nerve conductions in this arm. We're going to do what's called the EMG portion, or the electromyography, which is a few pin pokes. Most of the time this might feel a little bit like a flu shot or a blood draw, but it's usually not bad. It's a very small needle that goes just barely under the skin. The needle is an electrode and it's reading the electrical activity of different muscles, which are supplied by different nerves. So it gives us information on your muscle health, your nerve health, your spinal health. So just a small little very fine needle here. It's going to go right under your skin, a little poke into the deltoid muscle. You're going to listen to that. Push your arm out against me. That's your muscle firing. Now you can just let that relax. When the needle moves through the muscle, it gives off an electrical discharge, which is normal. If there was nerve damage, there's certain sounds and patterns I would be seeing. So that's all normal, which is kind of what I expected. Here's a poke in the bicep, little poke here. You doing all right?
Mm-hmm. Yeah, I barely notice it. That's okay.
This part of the test is more for a pinched nerve in your neck, which based on your history I'm not as worried about. Poke here. As I move down the arm, you have more nerve endings per area, so you might feel it a little bit more. Still doing good?
Mm-hmm.
Now we're going to do your thumb, which is supplied by the carpal tunnel nerve. Poke. This tends to be the worst spot. Doing fine?
Yeah, okay.
So we're done with this arm. So that's basically it. A pretty classic carpal tunnel EMG. So I get a printout here. I'll put a report together, and the doc will have that in about 5 minutes.
Okay.
Well, thank you.
Thank you. It was easy. The
Great.
shocks are surprising, you know, when
Yeah.
they come. The needle is not even as bad as a flu shot. It's
Okay, it's a very small meeting.
Yes.
You did great. Most people come in very nervous and leave saying it wasn't bad at all.
no, it's not.